insane amount. Ungodly amounts. That'd be like IFBB Pro, Mr. Olympia amounts. Probably even less than that. But there are a lot of variables here, Dante. First and foremost, if you're getting your testosterone from a credible pharmacy and not an underground lab, chances are your test is just fine. I wouldn't worry so much about that. What's up, guys? Welcome to the Hormones Happen podcast. This is a podcast for men and women like you who know the care we receive is dictated by greedy pharmaceutical and unethical insurance companies that want to keep us sick and dependent on the system. Screw that. I'm here to educate you on the amazing benefits of hormone replacement therapy while dispelling the bullshit lies created by the fake news in the media. I'm your host, Jeremiah, and I'm a nurse practitioner who owns and operates an HRT clinic. I've seen firsthand the neglect and lies told to men and women like yourself to prevent them from taking control of their health. Together, we can create a better future for people like us. Join me in the fight for your hormones. What's going on, guys? Welcome back to another episode of Hormones Happen. Today, we're going to talk about HCG, or human chorionic gonadotropin. Now, my views on this have changed wildly since the conception of Steel City HRT and weight loss, because I've always viewed HCG as something we use to promote fertility in men who are on TRT, which it's true, it's used for that. But I have really come to realize that there are so many significant benefits outside of that, that using this as an adjunct in any TRT protocol does have benefits. However, there is a select population of people who HCG is not a great option, which we will talk about later in the episode. So join me today to talk about the amazing benefits of HCG in used with TRT. Some of the biggest issues associated with TRT include shutting down our natural or endogenous production, because your body doesn't know that you're getting your testosterone through a cream, through a pill, or through an injection. Your brain thinks it is making too much. So what it does to normalize this is it stops making stimulatory hormones, luteinizing hormone, and follicle stimulating hormone, which ultimately leads to decreased production of testosterone. Because naturally, the pituitary gland, specifically the anterior pituitary gland, creates a luteinizing hormone, which then stimulates what are called Leydig cells in the testes to make testosterone. Now, this also increases our intratesticular testosterone, which is several times, up to 10 times higher than what's in our actual blood. And when we decrease our natural production of LH, we decrease our natural production of testosterone, and we ultimately decrease our natural production of intratesticular testosterone, the concentration of it, which then leads to decreased sperm quality and ultimately, not necessarily infertility, but decreased fertility. Okay, TRT is not birth control. I have many men who have children now after starting TRT, and they didn't before. So it's not birth control, guys, but it does decrease your fertility. So young men getting on TRT, this is something to think about. But what can we do? How can we combat the decrease in our natural endogenous production? Well, enter HCG. Now, HCG, or human chorionic gonadotropin, is actually produced in the placenta in a woman during pregnancy. Now, men do not naturally produce HCG, so we need to supplement this if we're going to use it in any significant quantities. Now, what HCG does is we call it a luteinizing hormone mimetic, meaning that it acts essentially as luteinizing hormone in the body, increasing activation of the Leydig cells in the testes, now producing endogenous testosterone, and ultimately increasing intratesticular testosterone, which improves sperm quality, increases fertility. Now, another I guess, downside you would say to having a decreased endogenous system is testicular atrophy. So the testicles will shrink. And for some guys, this can be a real issue. This could be a deal breaker as far as the TRT process goes. But the reality is it's cosmetic. Okay. It's mainly cosmetic, but once again, it does decrease your fertility. And HCG can help to promote the increase in the fullness and improve fertility. I have several men on HCG, and I've asked them, have you noticed an increased fullness in the testicles? And every single one of them has said yes. Now, this has also been well documented in studies as well. But, a lot of guys ask me, how can I prevent the shrinking of my testicles? Well, HCG is a great option for that. I also have a lot of guys who are in the process of family planning, and they have tried to conceive, just on TRT and been unable to. So HCG is the next logical step to helping to increase that fertility. But there are other benefits of HCG too, other than the fertility and the testicular shrinkage.
Loving this content? Make sure to follow us on Instagram, Facebook, and TikTok for even more insights. And hey, while you're there, don't forget to like, comment, and share. It really helps us grow. Now, let's get back to the podcast.
Well, TRT has a plethora of benefits, mental benefits for men, helping to improve attention, energy, directable aggression, as I call it, also acting as a natural antidepressant by increasing serotonin reuptake transporters. Some men feel a significant mental advantage or benefit when they incorporate HCG. It's really difficult to say why that is, but it makes sense that if you're replacing your testosterone through two mechanisms, both exogenously via cream, pill, needle, and endogenously we're stimulating or trying to jumpstart our natural production, it almost seems more complete. The body is producing the testosterone through two different mechanisms as opposed to one. And I have many patients who have asked me to start them on HCG simply for that reason. No concern with the testicular atrophy, no concern with the fertility, but they have talked to other people because some clinics will prescribe HCG right off the bat. And I always thought this was more of a cash grab. I thought it was unnecessary because it can be very expensive depending on where you're getting it from. But I was always against it. But after starting these men on the HCG and following up with them and hearing the amazing stories of their improved sleep, their improved mood, and I hear this a lot and take it for what it is, a sense of general well-being, okay? I hear it all the time. So there's no way that this could be just a fluke. There is something about HCG and using it in conjunction with TRT that helps improve mental well-being and also augmenting that testosterone through different mechanisms. Now, one other thing we can hypothesize is when we're making testosterone through our natural endogenous production, there are several other metabolites that have to be checked off before we get to testosterone, right? We have DHEA, androstenedione. We have all of these other upstream hormones of testosterone that, when going through the natural production, could potentially be one of the differentiators. So, for instance, a natural level of, let's say, a total testosterone of 700 is not the same as an exogenous level of 700. Although on paper, they're the same, and you may think, well, 700 is 700. What you have to realize is that a natural 700 is going to have several other metabolites associated with that number versus the exogenous being testosterone. So the testosterone can break into downstream hormones, but it can't convert back into upstream hormones that all basically stem from cholesterol and ultimately the mother hormone pregnenolone. So that is one hypothesis that we have regarding why increasing our natural endogenous production may give us a better sense of well-being because we're now basically fulfilling all of these other upstream hormones. Now, while HCG may sound amazing, there are some people who just wouldn't benefit from it. And so, who are those people, right? So, when we look at low testosterone, also called hypogonadism, we break it down into two categories. We have primary hypogonadism and we have secondary hypogonadism. Now, primary hypogonadism is basically an issue with the testes. So the brain, the hypothalamus, is releasing gonadotropin-releasing hormone to the anterior pituitary gland, which then makes luteinizing hormone and follicle-stimulating hormone, send them to the testes, and the testes make testosterone. With primary hypogonadism, the brain is telling the testes to make testosterone, but the testes are saying, no, we either don't want to or we can't, right? And we call this testicular insufficiency or eventually testicular failure. It can be from a variety of things, such as chronic infections of the testicles, surgical removal of the testicle called an orchiectomy, could be trauma to the testicle, potentially lesions, calcium buildup. There's a variety of things that could be causing this, but the issue with your low testosterone, the cause is at the level of the testicles. Now let's flip the switch on that. What's the other cause? What's secondary? So secondary hypogonadism is an issue with production of the stimulatory hormones, either luteinizing hormone and follicle-stimulating hormone, or even higher up in the hypothalamus with an issue making gonadotropin-releasing hormone. I have a lot of patients who are MMA fighters, boxers. They've had multiple concussions, and this is one of the causes of their low testosterone. People who've had traumatic brain injuries from traumatic car accidents, motorcycle accidents. Also, we can't exclude the potential of a potential pituitary adenoma, a cancer, or a tumor. So there are a wide variety of causes of hypogonadism. Now, with primary, like I said, an issue with the testicles, it doesn't matter how much luteinizing hormone we give someone. If the testicles don't respond, they don't respond. So HCG in someone with primary hypogonadism would be kind of a waste of money and time because we're stimulating the testicles to do something they're not going to do. So for someone with primary hypogonadism, I would not recommend HCG. I would recommend TRT. Okay, just TRT. I think HCG would probably be a waste. You may get some response. Hard to say. The only way to really know how unresponsive the testes are would be to get your initial blood work prior to supplementation and checking luteinizing hormone and follicle-stimulating hormone. That's why when you start TRT, it's really important to get a good initial set of labs. That way you can have a more complete picture of what is causing or driving your low testosterone.
If you're serious about optimizing your health, don't stop here. Visit stillcity-trt.com for in-depth information on all things HRT and TRT. Now let's get back to the show.
Now, how does HCG come and how do we take it? So it's typically sold under the brand name Pregnol. Compounding pharmacies cannot compound HCG. You have to get it via brand name. And it's given subcutaneously, just like insulin, just like tirzepatide, semaglutide. And typically, dosing varies wildly. It really depends on whether or not your goals are fertility, your goals are general well-being, but doses can go anywhere from 200 IUs all the way up to 2,000 IUs. Now, typically for fertility, you're going to be using higher dosages. And for general well-being and potentially just augmentation of your TRT, we're looking at about maybe 250 to 500 IUs 2 to 3 times per week. Some guys will even do lower doses, like maybe 100 IUs once daily or every other day, just to maintain more stability with the levels. It really just comes down to the individual and essentially what kind of needle burden are you willing to undertake. Now, one thing I do see oftentimes with clinics that incorporate HCG into general TRT protocols is a significant underdosing. If you're doing 25, 50 IUs, that's just not going to work. That's underdosing. And you need at least an efficacious dose. And what is an efficacious dose? It's really difficult to tell. I really think a lot of it's going to be symptomatic resolution. But if you're doing too little, it's just as bad as not doing it at all. Regarding the pharmacokinetics of HCG, it has a half-life, meaning that half the medication's out of your system in 24 to 36 hours after an injection. Now, realize when you inject subcutaneously into the fat tissue, it's going to absorb much slower than if you were to inject intramuscularly into the muscle. And the actual biological effects of HCG have been hypothesized to last several days. And that's why oftentimes dosing protocols usually include 2 to 3 times per week. But once again, everyone's different and everyone's going to metabolize HCG at different rates. So it's not one size fits all. Some people are going to notice 2 to 3 times is perfect. Some people are going to need to go every other day. Some people may even elect to do every single day. The dosing strategy is really based on your goals. For instance, for fertility, you're going to want higher doses, probably more frequently. If it's for general wellness, you may be able to get away with lower dosages less frequently. Everyone's a little bit different, and I always encourage experimentation. Some questions that I always get asked regarding HCG is, can you take HCG as monotherapy without TRT? And the answer is sure. A lot of people view HCG as a stepping stone to TRT, as a natural way to boost testosterone. However, natural is kind of a misnomer because, remember, men don't make significant quantities of HCG. So there's nothing natural about injecting us with a hormone that's made by the placenta in a female. But the thought process of basically stimulating or jumpstarting our natural production of testosterone, I understand that. One caveat, like I said earlier, is that if your issue is at the level of the testicles, you have primary hypogonadism, monotherapy with HCG is going to be a waste of your time. And testosterone, TRT, is really what you're going to need. For some men, HCG as monotherapy will work. I have seen in clinical practice that the levels are much more modest than with TRT. But once again, for some guys, that is the approach they want to take. There's nothing wrong with that. Now, how long does it typically take for HCG to work, or how long does it take for you to actually notice improvements? Well, while it varies, typically what I hear, what I see is about 2 to 4 weeks, especially when you're looking at the testicular size or some of the mental benefits. And also, HCG is very safe. So HCG is a very safe hormone. It's well tolerated with minimal side effects. But just like with TRT, you should be working closely with a provider who is knowledgeable in this area.
We interrupt this program to bring you an important announcement.
Look, guys, the harsh reality is that aging naturally is no longer possible. We're bombarded with endocrine disruptors every day without even knowing it. Seeking treatment usually leads to the prescription of unnecessary medications and unwanted reassurance that what we're experiencing is normal, but it's not. At Still City HRT and Weight Loss, we not only ask questions, but listen to answers and believe that treatment cannot be a cookie-cutter protocol. If you're curious about the amazing benefits of hormone replacement therapy or have been turned away by our traditional Western medical society, don't hesitate to call 719-669-4223 now to schedule labs and discuss treatment options. All right, guys, welcome back. Let's pound out some questions. This one's from Jay in Wisconsin. What are the differences between testosterone gels like Androgel and testosterone creams? I really enjoy the podcast. Well, thank you, Jay. I appreciate you as well. The difference between creams and gels, so Androgel is basically the commercial version of topical testosterone replacement. It is an alcohol-based gel and it's very underpowered. And what I mean by that is it varies from like 1% to 1.62% concentration. You cannot apply it to the scrotum. You apply it most guys apply it to the shoulders. I've seen guys get some, modest effects with it, but creams are water-based. We have a variety of different bases that range from a Trevis to Versa base to Alage. There's so many different bases. And basically what it is with either one of them is you're putting a powder into a base, which is a cream or in Androgel's case, a gel. And so the concentrations vary. So for instance, for creams that I prescribe men, it's 20%, which is essentially 200 milligrams per gram. And some compounding pharmacies will even go higher, as high as 220 to 250. But there's a lot of question as to whether or not those are stable. It is hypothesized that above 200 milligrams per gram, the extra just gets evaporated out and it's kind of pointless. You can only put so much solid into an actual base or a liquid and have it be stable. So creams are much stronger, but you can also apply them to the number one spot for topical application for a man, which is the scrotum. And not just a regular scrotum, guys. I know we've talked about this ad nauseum, but shaven. That hair makes a huge difference. It's been shown in studies up to 400 points difference because all the cream that's on the hair is not getting into the capillaries. So the cream can be applied to the scrotum. It's much stronger. Androgel, benefit to Androgel is this is the topical version that's covered by insurance. So if you are blessed enough to jump through all the hoops to be treated by your insurance, Androgel is unfortunately what you're going to get. And what I always tell everyone is something's better than nothing. So if Androgel is what you have, work with the Androgel. If insurance doesn't cover your treatment, you have the availability to use creams when you go to a specialized hormone clinic that works with compounding pharmacies. That's the difference. Our next question comes from a Dante in Colorado. I love the podcast. I'm a 26-year-old male and inject 200 milliliters of test per week. I've noticed red painful bumps at the injection sites and I don't feel as good. Is it possible my test is bad? Thank you. Well, Dante, first and foremost, I'm pretty sure he meant 200 milligrams, not 200 milliliters. That would be an insane amount. Ungodly amounts. That'd be like IFBB Pro, Mr. Olympia amounts. Probably even less than that. But there are a lot of variables here, Dante. First and foremost, if you're getting your testosterone from a credible pharmacy, and not an underground lab, chances are your test is just fine. I wouldn't worry so much about that. The next question is, you didn't specify, but where are you injecting it? I have seen this on several occasions. I've experienced it myself. When you inject subcutaneously, sometimes it can cause some irritation to those tissues. And you do get this redness and a swelling and pain. And one of the working hypotheses behind this is that when you have all of these cytokines and inflammatory markers going to this area causing the redness and the swelling, that you may be deactivating some of the medication and you may not be getting its full effects. Typically, when this happens to one of my patients or myself, I will just recommend injecting intramuscularly because you don't get that same effect unless you're doing poor injection technique, not cleaning the skin. Using a large needle, you can get deep abscesses. So it's always important to clean the skin to eliminate that. But if you're going muscle, you're doing good injection technique, clean technique, you shouldn't get any of this. But going sub-Q for some guys, they're just extremely sensitive. The other thing too is changing your injection sites. So if you're not rotating injection sites and you keep going to the same one over and over and over, that oil may not be fully absorbed before you inject again, and you're causing a lot of pressure, plus you're going to be sore, a lot of irritation. So changing your injection sites, ensuring that you're going through a credible clinic for your testosterone, and then maybe even going intramuscular would be a good benefit for you because you may not be feeling good because of the inflammation that's potentially deactivating some of the active compounds in your testosterone. This question actually comes from the Facebook post. A Frankie asked, how does TRT affect thyroid? So this is multifaceted, and there's a lot of research and debate regarding how TRT exactly affects thyroid. But some of the literature has told us that testosterone actually helps promote the conversion of T4 to T3, which T3 is the active hormone that actually acts on the tissues. It has told us that testosterone actually helps to sensitize thyroid receptors, increasing its effectiveness. But we've also seen that testosterone can decrease TSH, which, as you know, when you have decreased TSH, it underactivates the thyroid and can lead to hypothyroidism. So the studies really give us either a neutral effect, meaning that testosterone has no effect on the thyroid, or it shows a beneficial effect in helping to improve thyroid. And oftentimes what I've seen is men with very slight hypothyroidisms will improve with testosterone supplementation. But if you have a significant hypothyroidism, you can give these men testosterone all day long, and they're going to feel like crap until you replace their thyroid hormone. But I have not seen testosterone cause a negative impact in anyone's thyroid hormones. I want to thank everyone for listening to today's episode of the Hormones Happen podcast, and hope that you were able to find some value in the information that was provided today. If you have any questions that you would like to have discussed on the podcast, please send them to the email listed below, or message us on the Still City HRT and Weight Loss Facebook page. Remember, you are not alone in the war on hormones. Stay optimized.